It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best physicians in all of the Dallas-Fort Worth area that are changing people's lives.
That's what it's all about, doctors helping change people's lives, like our first doctor, pain management specialist, Dr. A.L. Shaw.
We treat a lot of various diseases that have chronic pain, and musculoskeletal pain is one of the big categories. Within the category of musculoskeletal pain, you have people that have fibromyalgia, lots of other directly related skeletal problems, and one of the more controversial diseases that you have is chronic Lyme disease.
I had been experiencing pain from my head to my toes, and I had been to numerous doctors, and I knew there had to be something different, something better, because I knew I couldn't live this way and I did not know what the pain was. I found Dr. Shaw in 2002. During our first visit, he asked me where my pain was, and I said, there is not a place in my body that I do not hurt. And he said, well, fibromyalgia, you don't hurt from head to toe. I said, have you ever been tested for Lyme disease?
Gloria had several problems. She had the myofascial pain, she had joint pain, and still does. She had what we call neuromatous. She'd had some nerves operated on because of pain. She has severe headaches, and some of her headaches are vascular, similar to migraine. I get to visit my family that live in Oklahoma. I can make an occasional car trip. I can do things that I didn't think I was ever going to be able to do again. He listens to every ache and pain you have, and because of the medications in his treatment plan, we have got to where I am today. Several years after we started treating Gloria, one day she came in all smiles, and she said, for the last 2 weeks, I've not hurt at all. In someone that's had chronic pain for years, it's an incredible miracle. During my visits with Dr. Shaw, one of the things that we have discussed is not only mentally, but physically, to achieve pain freedom. And each visit, I feel like we are getting closer and closer to that objective.
And welcome back to the Best Docs Network, and we are excited to have to the program today prosthodontist Dr. David McFadden. And doctor, I got to get this right out. What is the difference between a prosthodontist and a regular dentist?
Well, that's a good question, Jim, and I'm glad you asked, because there's a big difference. People can understand the difference in medical specialties. It's like comparing a family practitioner to a cardiologist. In dentistry, it's the same. General dentists go to dental school for 4 years to get a general dentistry license. Prosthodontists go 3 extra years beyond dental school to learn in-depth treatments like reconstructions, implant dentistry, crowns, bridges, veneers, etc. So there's a big difference between the two different forms of dentistry.
So if I'm going and I'm looking for a new smile or I need crowns, I'm going, not looking really for a cosmetic dentist, I'm looking for a prosthodontist, right?
That is correct. In its earliest forms, general dentistry was really in place for simple extractions, fillings, and the occasional crown. The specialty of prosthodontics, actually, the word itself means prosthetic. So anything that's prosthetic, crowns, bridges, dentures, partials, implants, should be handled by a prosthodontist, someone who's a specialist in prosthetic dentistry.
I see. So if we're looking for a specialist like a prosthodontist, Do we also pay the higher fees than compared to the regular dentist?
On average, no. You know, the market is so competitive, especially in the big cities, that your average prosthodontist charges about the same as your average dentist for high-end work.
Okay, so the bottom line is this. If I'm out there wanting some extensive mouth work done, whether a new smile, crowns, you would pick a prosthodontist over a dentist because?
That's what we're qualified to do. And we're trained for 3 extra years to do just that.
There you go. Appreciate it. Thank you very much, Doctor. Dr. David McFadden on the Best Docs Network.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com. As always, for more information on any of our fine doctors, just visit our website. It's bestdocsnetwork.com. And now let's take a look at Dr. Paul Worrell, who is now able to treat any of his patients that suffer from severe allergies.
I was having a lot of deep congestion, sneezing, nosebleeds, and severe headaches. And we found out that Dr. Worrell now has the allergist in his office, so when I spoke with him, he gave me time to go down and talk with the allergist, and then I started talking to him about my symptoms.
Typically, people will have allergies that show themselves in a similar pattern at the same time each year, if they're seasonally related. Sometimes environmental allergens will show themselves as part of their history in terms of if they're allergic to dust or if they're around dogs or cats. And so after we question the patient appropriately and do the appropriate exam, then we go ahead and if the patient is inclined to do so, send them down to our allergy lab here in the office.
I was given the allergy test, so I got about 50 needles in both arms and realized I'm really allergic to pollen and mold and ragweed, and that's why I was coming to Dr. Worrell so consistently and why I was not able to breathe and had these bad nosebleeds.
Questions are given to determine that they are good candidates for testing and desensitization. And then they proceed with a procedure that takes about 30 minutes. And during that time, the 48 top allergens in the area are tested on skin testing. The results are measured out and the determination is made whether they're a good candidate.
The first steps that we have to go through, I got to come in the first week and I have to get my first round of shots. And so I get a shot in my left and on my right arm. So my first visit, the allergist gives me the shot. And then the second visit, I give myself the shot. Eventually, I'm just going to have to come into the doctor's office just to get my meds and then take them home and give myself my shots. And so I'm going to probably take these shots for about a year.
Usually within a few months, they'll be having significant relief of their allergies. And then we continue that on for as long as 2, maybe even 3 years.
My relationship with Dr. Worrell, first of all, I love him. He's definitely one that explains everything to you. He's really friendly, his staff is friendly. I really trust him when he tells me anything that's going on with me. I just can't see myself going anywhere else. I really enjoy coming to him.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
My daughter Autry was having really bad eczema, covered from down her knees to her feet, all over her back. You know, it was completely covering her body, 40%. And she had been in the hospital twice, multiple doctor's visits, steroid creams, anything you could think of to get this to go away, it was not working.
Atopic dermatitis or eczema is one of the most common conditions or disorders of the skin that we see in children. It usually presents itself as intense itching and areas of skin that are red and inflamed. This condition is usually chronic, can last as short as a few months, but can last several years and can have a big impact on the quality of life for kids.
Dr. Ghali approached us and asked us to do the study with the CLN body wash, and she immediately changed. We saw a difference in 2 weeks, and then by the end of the 12-week study, she was down to 1% and has had very few outbreaks since then.
Audrey presented to our clinic last year, and she was a patient who had recurrent atopic dermatitis. It was a limited body surface area, but what it goes to show you is that in atopic patients, it doesn't take a lot of body surface area to cause problems. And so for this particular child, it was her feet. She began the study last year, and within a few weeks, using clean body wash, we saw a big improvement in her.
Before we got the CLN body wash, she was sick all the time. Since getting this eczema under control, she hasn't been sick. We've had one doctor's visit, and it was her well visit. She's healthy and happy and running around.
Not only did we see the improvement clinically, that was something that you could see at home. The mom noticed that the child would sleep better, would make it through the night, would be more focused and more playful. And that speaks very highly of the product and the response that we saw early on and sustained over a period of several months in the study.
The CLN body wash in our house is, lovingly referred to as the liquid gold. We love CLN body wash.
Denise's passion is tending to her show dogs, but had trouble doing that due to chronic pain in her hands until she met Dr. Traum. To find out more about Denise's story and other life-changing stories, log on to bestdocsnetwork.com.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that we're removed so that we're sure that we've gotten all of the skin cancer. It has the highest cure rates of any technique of treating skin cancer and enables us to preserve as much normal tissue as possible while still removing all of the skin cancer. The technique is very much like the biopsy in that everything is done in the office. We just use a little local anesthetic, numb the area up, and remove the area that we can see. The way in which it differs from the biopsy is that we take the tissue that we excise and prepare it in our lab. We make our own slides, and I examine the slides under a microscope to determine if we've gotten all of the skin cancer. If we have, we stop there. If we haven't, we know precisely where any residual skin cancer is. We go back just to that area, remove a little bit more tissue, make some more slides, and keep repeating that process until we're sure we've gotten all of the cancer. If the skin cancer is very small and very superficial, the wound that results from the surgery that we do may be very similar to the wound they had after the biopsy. Very often it will heal satisfactorily on its own with good routine wound care. However, if the skin cancer has invaded more deeply or is wider than what it appears to be on initial exam, then we may recommend a repair of some sort. And they range all the way from simple side-to-side closure to a skin flap or a skin graft. And as with all cancer, early detection and treatment is the best way to cure skin cancer.
Don't forget, for more information on any of the outstanding doctors you see on today's show, you head to the website, bestdocsnetwork.com. bestdocsnetwork.com. That is the place to go.
It sure is. And now we're going to head to our next best doctor. It's bariatric surgeon, Dr. Philip Swanson.
And I was having health problems that was affecting my work even. My type 2 diabetes was getting quite bad. and I had problems getting around. So my company got me in to see a endocrinologist who got my type 2 diabetes under control. He told me that I was going to have to do something serious about my weight and suggested something drastic like bariatric surgery.
James Johnson, he's a 51-year-old man who significantly overweight, and he had high blood pressure and diabetes and high cholesterol and sleep apnea. And those things are all real common. It seems like because of the excessive fat cells, people don't think of that as anything other than you're overweight. But those fat cells actually produce lots of hormones and other chemicals that affect how your body works.
We could always lose the weight, but we'd lose 40 pounds and we'd gain back 60. It was a big yo-yo. We just couldn't be successful after the diet quit.
He decided that the sleeve would be a good choice. And the sleeve is a great choice. It's a less involved procedure than a gastric bypass. Basically, you change the shape of the stomach by removing the stretchy, baggy part of the stomach and making it into a skinnier tube-like structure.
Compared to where we were before, it's a whole new world. It's a whole lot different. I didn't really realize how bad I felt until after I had the surgery. I had a new baseline as to feeling good.
And the sleeves work very well. And he's lost 60 or 70 pounds, and he is now off of most of his medicines.
We're happy as can be with losing weight, and I think the only creature in Texas more happy than that is my horse. You know, you take the saddle out there now and his eyes didn't get big as saucers. Dr. Swanson's been wonderful. I mean, he's been everything that you want.
If you eat healthy, you're going to be healthy. So what are the major rules for eating healthy? First of all, eat breakfast. It takes your body off that emergency that you've been on overnight. Emergency isn't good for your body. It causes lots of problems with blood pressure and cholesterol. Secondly, eat anything that is red, orange, or green. Those types of foods that are red, orange, or green tend to have what's called phytochemicals. They tend to be antioxidants and they prevent heart attacks, strokes, and many cancers. Eating a Mediterranean diet is a great idea. The Greek people have a wonderful idea about what to eat. They eat a lot of beans, a lot of fiber, not much in the way of red meat that's high in fat. Fish is an important part of your diet. We need to eat less red meat in America and more fish, and also more non-red meat like the white meats like veal, chicken, turkey. Red meat has more cholesterol. Also, barbecued food is not a good idea. The barbecued flavor occurs because the smoke deposits chemicals onto the surface of the meat that taste good, but they also tend to be cancer-causing chemicals. So limit your barbecue to once a week.
Lifeworks Group is, we like to say, a collaborative therapy group. So we work with all walks of life, all kinds of issues. We have plenty of therapists to cover, anything that you could come up with. What's nice about our group is that we're very holistic, so we work as a team. We share cases, and then on top of that, we add in yoga therapy. The way that it works is we really find that in actual, cognitive therapy with a therapist, it's all in your head and you are discussing and knowing. It's the knowing of the issues that you have, but oftentimes we find that you can intellectually understand some of your issues and how to solve them. And it allows people to really feel their feelings and get them to really experience what's going on in their lives, what's going on in their bodies, and what's going on in their hearts.
Yoga therapy has been so important for me, especially with Petrie and Lifeworks. I think they've done a great job of having an open space and a place of healing. For me, it's been very centering for me, and especially in the mix of craziness in my life that I feel, I'm having to make the time for me to center, to be grounded, and every time I leave, I am more energized and feel like revitalized.
I have benefited from yoga in a number of ways. It is great for me mentally, physically, and spiritually. In the midst of busy, crazy life and 2 children, it gives me the time to focus inward on myself.
So just about any human being, I believe, can benefit from yoga therapy. I see adults for yoga therapy, I see families, and my most enormous passion right now is working with children. Yoga for children is incredibly beneficial because number one, it's just powerful for them and it's empowering. Yoga for kids is a little bit different because it's a collaborative effort. They get to participate and it's very creative. And we find that that's a really nice outlet for the kids after a therapy session to have yoga, let them be themselves for a little bit. So it's nice.
The Best Docs Network, of course, is all about doctors in the Dallas-Fort Worth area that help change people's lives. Like our next doctor, ear, nose, and throat doctor, Dr. Joshua James.
I had sinus pressure all in this area, all the way down to the jawbone, pain and swelling, and it wasn't just occasional, it was every day. I had been to about 8 doctors in the Metroplex. All of them had told me that there was nothing there, nothing they could do for me, and to basically go home, live with it, and for me that was not an option.
In Vicky's case, she presented to me with a history of constant headaches, chronic sinus disease, and had radiographic evidence of significant sinus inflammation. She had been treated with multiple rounds of antibiotics, nasal steroid sprays, and allergy medications with minimal relief.
My first appointment with Dr. James, he told me that he thought that he could cure me, that he thought that it was a balloon procedure that I needed. He explained that nothing is 100%. This might work and might not, but I feel like with your condition that you've got a great chance. So it's up to you whether you go for it.
Usually on the first visit, we'll discuss their history, how much of their symptoms are related to actual sinus infections and sinus issues, and how much of those relate to just allergies. And then that kind of determines what type of further evaluation or diagnostic procedures we need to do. And
he did the procedure within 10 days. I was pain-free, have had absolutely no problems since. And as far as I'm concerned, he's a godsend.
Within 24 hours of completing the surgery, her headaches had resolved and symptoms had improved significantly.
Dr. James has changed my life for the better because the activities that I pursue, I'm able to do my gardening, my housework, just general things, travel, any activities I want to do with my grandchildren, running, riding bicycles. I didn't have the stamina to do that before. Now I'm able to do even more because I am pain-free.
Jacob's quality of life was affected due to gastric reflux disease until he met Dr. Glenn Eide. To find out more about Jacob's story and other life-changing stories, log on to bestdocsnetwork.com.
I began experiencing lower back pain in June of 2010. In my industry as a chiropractor, I didn't seek conservative care until about November of 2010. And at that point, I was so bad that conservative management wasn't going to work for me because I just couldn't relax enough.
One of the pathologies that causes low back pain and leg pain is something called the spondylolisthesis. And what spondylolisthesis means is slipped vertebral body. And what that does is it causes malalignment in the vertebral spine alignment, and it also makes the canal smaller. If you look at this from the top and look at the canal, this is where your nerves go. But if I allow one of the vertebral bodies to slide forward like this, you notice the canal gets smaller, and that actually pinches on the nerves and causes leg pain.
In March of 2011, I guess it was, had surgery with Dr. Myles, took a 5th lumbar disc out. They also went in and So supplemented the stability of the lumbar spine with some screws that they put into the vertebrae. Felt wonderful. I was probably 80% better after the surgery.
Jared came in with back and leg pain. It was very severe, and because of Jared being a chiropractor, he took care of it himself most of the time. So what we did in his situation is we basically opened up the canal. I placed a cage inside the disc and then brought this piece of his spondylolisthesis back into a normal alignment. And I placed screws in here to hold everything stable, and that allows this to fuse and become a solid joint. And that got rid of his leg pain and got rid of his back pain.
The post-surgical status of me right now is I've never felt as good as I feel. I've always thought of all health professions having a necessary place. Me being in the health field, I put it off too long before I actually sought a more invasive route.
Dr. Armstrong has a very physically demanding job. What we needed to do for him was to achieve pain freedom for him, and we made his back pain history.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
I had gone through 2 major back surgeries. I have a lot of bolts and screws and nuts and squirrel cages and fusions in my back. I have had a terrible time with all of the pain I experience in my everyday living. I lived on pain pills and my quality of life was awful. I wasn't the guy I wanted to be for my family, for myself, so I needed another way of life.
Greg is a prototypical guy. He hurt his back doing some heavy lifting. He ended up having a spine surgery, and he ended up having a second surgery. And when he came to me, he was very disappointed with the results of his surgery. He was almost at the end of his proverbial rope, feeling that there was nothing for him.
He said I was pretty screwed up. He said my back was quite a mess. He went back to the original x-rays and took me through this, and I went through a lot of spinal injections. He had recommended we did those, and they gave me some temporary relief, as he said they would. The pain would come back, and so we got into the next phases of doing the spinal cord stimulator.
That is an electrical device that is implanted in the spinal canal next to the nerve roots that are causing their pain. It produces a sensation of pressure or tingling in the areas that they typically have pain. The brain actually pays attention to that pressure, that tingling sensation, more than it does the pain. So they actually don't feel as much pain, or sometimes no pain at all, from those typical areas.
I take and I turn it up, I put it on, and I turn up the volume, and I sit for 5 minutes or 10 minutes. That's better than taking the pain pill because I can manage my pain much better. I really do have pain freedom when it comes to working with the operations. And I'm very, very pleased with where I'm headed.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in all of the Dallas-Fort Worth area that are helping to change people's lives.
And for more information, of course, for any of the outstanding doctors you see on today's show, head to the website. It's bestdocsnetwork.com.
And if you have a question or comment for us, we'd sure love to hear from you. Just send us an email at info@bestdocsnetwork.com.
All right, so long, everyone. We'll see you next week.